I think we're going to see, my hope, so there's bad news and good news. So whenever there's government control, there's sort of I think, and I've seen this in America, where there's a reaction in the right direction. And so to be the optimist, I say as government gets more involved in healthcare, it becomes more apparent that we need to have an alternative to the system that stands, the heavily intruded in government established healthcare system. We're going to have to start looking for alternatives. The example I give is the homeschooling movement in relation to education. So we can't fix, we've not been able to get rid of the Department of Education, which would be great for if we could do that. We haven't had any success there, and it's not even suggested by very many politicians. But what did we do? Well, we started the homeschool movement and the private school movement, which has had massive success. So I think we're going to see the socialization, progressive socialization of healthcare in America. But the good news is, I believe that if we fight for our liberties still, we have opportunities within that where people get a bit of clarity that they need to take responsibility for their own healthcare needs, financially, as well as personal health choices and all the rest of it, as well as taking care of elderly relatives rather than relying on Medicare and Social Security, being responsible. So I believe the market responds, even when the government's doing terrible things. Good things come out of it, because the government option eventually, like it did with the public school system, became a non-option for Christians, and became a non-option for many people. They said, oh, it is that bad, we can't use it anymore. I think we're going to see the same for healthcare. It's going to be that bad that we can't use it anymore, because all the money is going to be spent on abortions and all the other stuff. And there's going to have to be this alternative system that we'll find. So that's the good news. I don't believe the fight will be over if we repeal Obamacare. Again, it gets back to this issue of what is the biggest problem here, and it's the whole socialization of the American healthcare system and the mix of crony capitalism as well. Obamacare is just doubling down on that. It's just making decisions that just follow the direction we were going. Obamacare is a terrible piece of legislation, very corrupt and illegal, but nonetheless, the system was broken before that. So if we do repeal Obamacare, my fear is that we'll proclaim that as a political victory and assume that the job is done, when we will still have those problems, and the problems are there for the patient and the doctor. That if we go back to the way it was before Obamacare, we're not going to be helping anyone. What we really needed was 100% doctor liberty, which would mean 100% patient liberty, and restore that doctor-patient relationship by just government having nothing to do with medical services whatsoever. That's the goal of our film. That's what we want to show, the benefit of the government not being involved in healthcare, and that's the only solution that I can imagine. I think Americans need to be aware that they can restore medical liberty without actually just thinking of it as a political issue. There's things that we all can do. Our last film about education dealt with the issue of how do you deal with government-controlled education. The first one is you don't use it, right? So you just stop using it. And that's some of what we're talking about in a healthcare film. There's a lot of personal responsibility that goes into the issue of health. Not just looking after yourself and how you live your life and what do you eat and all the rest of it, all those important issues, but also who looks after your elderly relatives. Who's responsible for yourself and your family? Well, you are. You're responsible for your elderly relatives, not the government. And so moving away from welfare and taking on personal responsibility, churches taking on responsibility in terms of charity towards the genuine needy. These are stories in our film that we're talking about. So finding options that are out with the government model. Another good example is people that decide not to use third-party pay systems and not use government provided welfare medicine, but find another option. And a good example is a cost-sharing ministry like Samaritan Ministries that I use, where you can you can have your healthcare needs met by other Christians. Rather than going to the government, you share the responsibility for one another's health. And that's a much better model, and the government's got nothing to do with it. Of course, the needs that you share are not going to go to abortions or other things that you disagree with, because it's a Christian organisation, and that's not true for a lot of insurance programs. It's definitely not true for government provided insurance. So that's the issue there.